At first we thought that he just had a regular cold. We were a little bit worried that he was a little tired and lethargic, and everybody always says when your kid's lethargic, you might want to have him checked out. So we did, but the doctor assured us that his chest was clear and that he was just run-of-the-mill viral illness. So we brought him home.
But when Graham didn't improve, his parents took him to the hospital.
I think it was a Thursday night that his fever kept spiking and his breathing started getting a little more rapid.
RSV is an abbreviation for respiratory syncytial virus, and it is a very common respiratory pathogen that occurs in infants and young children.
Dr. Bosco Pace is a pediatrician and neonatologist at McMaster Children's Hospital. He says while RSV is quite common, many parents are unaware of its symptoms and consequences, especially for high-risk infants.
Premature infants, by virtue of the fact that they have immature lungs and their immune system is underdeveloped, are most at risk for contacting RSV. However, there are other infants, such as those with congenital heart disease or chronic lung disease, who are increasingly susceptible in terms of developing RSV infection and in whom the infection actually becomes quite severe. The other groups of infants that are susceptible are those infants who have underlying pulmonary problems or severe respiratory disorders, infants with abnormalities of the upper airway, infants who are born with congenital abnormalities of either the respiratory tract or the diaphragm, and infants who cannot protect their upper airways, such as those who have neuromuscular diseases.
I'd never heard of RSV before. I mean, the first time I heard of it was when they actually started talking about it once they sort of diagnosed what he had in the hospital. So it was new to me.
The number of RSV cases rises during the winter season, starting November through April, and can be contracted in a number of ways.
Most commonly, it is acquired through touching, through kissing, through cuddling, and indirectly then through contamination with or contact with contaminated surfaces. It can survive for quite a long time on surface areas such as toys, crib rails, as I've said, and countertops for approximately 6 to 7 hours. It is also, in fact, viable and remains viable on clothes and also on the skin for periods from half an hour to as long as 4 hours.
Dr. Pace says while the symptoms can mirror a common upper respiratory tract infection, like a cold, RSV progresses to the lower respiratory tract, which can lead to a serious infection that may require hospitalization.
If the disease progresses, the child becomes increasingly lethargic, develops labored breathing with chest retractions. The cough may get potentially worse, and usually there is an accompanying wheezing. Sometimes the child tends to go blue, suggesting that this child is getting quite ill and may require oxygen.
To prevent RSV, Dr. Pace says the focus must be on avoiding risk factors, such as smoking in the household, attending large gatherings like malls, especially during the winter season.
Primarily, it is to avoid contact with infected individuals during the winter months, and most importantly, the emphasis should be on thorough hand washing if this does occur. The main message that we want to send out into the community for pediatricians and healthcare professionals, again, is education about RSV, the appreciation as to when the season starts, the focus on prevention, with the primary measure being thorough hand washing and the avoidance of potential risk factors such as smoking within the household, avoidance of large crowds or gatherings, and clearly staying away from infected individuals.
Discuss with your doctor ways to reduce the risk of RSV for your high-risk infant.
This is very important. Certainly, in the early parts of the RSV season, which is November, December, and January, and certainly for infants who are very young, who are less than 6 weeks of age, because they are at greatest risk for developing a very severe infection.
Listen to your gut when it comes to your children. You know, if you think they're sick, take them to the doctor. And if you come home and you're still not sure and they're just not right, bring them back.
For more information on ways to prevent RSV, ask your doctor and visit this website.